One of the questions I get is if I've had fusions and how many have I had is too many in order to have restorative motion surgery. In the cervical spine, we can reverse fusions and restore motion. The key film I need from you is a very fine cut CAT scan. And then I'm able to assess a lot of the different anatomy sections to determine if I can reverse some of those fusions. Even if you've had 3 or 4 fusions, I can often reverse 1 or 2 of them and restore motion. In general, I don't like to have people have more than 2 discs fused in the neck. You have 5 discs, so if only 2 are fused, that means you still have 3 left that move. And that keeps people really functional and keeps mobility and keeps them active. So a CAT scan is important, and yes, multi-level fusions can be reversed. I just need to assess it carefully. Thanks. See you next time.